Hi, my name is Kisa Baldwin. I'm one of the vets that works in the ICU at Carrara. Today I'm going to be talking to you about care of the tracheostomy wound for your pet when they go home. Your pet may have had a tracheostomy tube placed at some point because of problems with their breathing. Normally we place a tracheostomy tube to bypass the upper airway if it's swollen. Also sometimes for tick paralysis patients, if they've been on a ventilator, we will often place a tracheostomy tube. And sometimes we like to send your pet home and they may still have a tracheostomy tube wound. So what we like to do is send you home with a little care pack so that you can care for your pet at home. So today what we will probably show you is a couple of the things you might get in your care pack. Some gloves to put on when you're cleaning your pet's wound. You may have a bag with swabs that might be soaked with aqueous chlorhex, which is really dilute disinfectant, or some sodium chloride or saline. So what we like you to do is just clean carefully around the edges of the wound with your swabs, just to get rid of any debris or exudate or serum that's crusted on the edges of the wound to keep it nice and clean. Try to avoid the middle of the wound if you can. Then what we like to do is apply a barrier cream around the edge. It makes it a lot easier for cleaning next time. I like to use Sutures cream, which you can purchase at most pharmacies and Coles, just in the baby department. It's otherwise sort of used sometimes as a nappy rash cream, but it works very well around the tracheostomy wound. But try not to put it right in the wound, just around the edges of the wound. This is how you clean a tracheostomy wound. On discharge, we may ask you also to nebulize your pet's airway via the tracheostomy wound. This is a little mini nebulizer. You can buy these either online or at pharmacies. This just helps keep your pet's airway nice and moist. It helps a little bit easier for them to clear debris from their airway. If you're at all concerned about your pet once we've sent it home with a tracheostomy wound, please try to keep your animal calm, give us a call. We're more than happy to see you back and talk to you over the phone. Occasionally, your pet will go home with little sutures attached to its tracheostomy wound. These are very important. They're used for us to be able to open up the wound, and it allows your pet to breathe easier. By the time we discharge your pet with the tracheostomy wound, hopefully it is on its way to healing and your pet is breathing easier. However, if your pet shows signs of breathing troubles at home, you may be able to pull on either side of those sutures, and this will allow your pet to get more air in and allow it to breathe easier. And give us a call and then come down and see us or talk to us over the phone if you're worried. We do expect that your pet's wound will have a little bit of discharge on a daily basis. However, if you feel that it is excessive, or if there is anything that worries you about their breathing, please do not hesitate to contact us at VSS, and one of our team members will talk to you and you can make an appointment to come down and see us if you're worried.